The World Health Organization released its latest update on the spread of monkeypox yesterday. There are a total of 257 confirmed cases worldwide, spanning 23 countries where monkeypox is not endemic. That includes 26 confirmed cases here in Canada, where another 25 to 35 cases are currently under investigation. The WHO says monkeypox poses, quote, moderate risk to global health. So for more, let's go right now to Dr. Christopher Labos, epidemiologist and cardiologist in Montreal. Dr. Labos, good to see you.
Good to see you too.
Now, officials, as you know, in Quebec have already announced plans to vaccinate people with the smallpox vaccine. But monkeypox has also been detected in other regions of this country. The WHO also saying the sudden appearance of cases may suggest the virus has been spreading undetected for some time. So can monkeypox actually be contained at this point in this country?
I think it can. The majority of cases are still confined to the greater Montreal area, and most of those people are self-isolating now. So if we can get a handle on this, if we can get everybody who tests positive to self-isolate and prevent the spread to others, we should be able to contain this. Yes, there's a case in Toronto. Yes, there are some cases in the US, but as long as we can track them back to the original source, which appears to be the greater Montreal area for the most part, we should be able to contain this thing now, because monkeypox doesn't spread that easily. So as long as we can do the contact tracing and the self-isolation, all the stuff that we tried to do with some variable success during COVID, if we can actually do that with monkeypox, which is a much less contagious virus, I think containment is still possible, even if we do see the cases start to go up over the course of this week.
Now, I know we've been talking about it for some time now, but I think it's worthwhile to go back here and review what exactly monkeypox is, the kind of damage it can do, both short-term and long-term, to the human body. Talk to us about what we know.
So monkeypox is a virus. Like many other viral illnesses, it causes typical viral symptoms like fever, muscle aches, swelling of the lymph nodes in the neck, headaches, stuff like that. But sort of the classical sign, the thing that differentiated, is the rash, the pictures that people have been seeing. And it can look very similar to the type of rash that you see with chickenpox or with smallpox, although most people haven't seen a case of smallpox in quite a while because it was eradicated a couple of decades ago. So in some respects, it can be difficult to diagnose if you're not thinking of it. If it's not at the forefront of your mind, it may not be the first thing that pops into your head when you see somebody come in with a fever and a rash that sort of looks like that. But the way to diagnose it is actually with lab tests, and that is why you're seeing this bit of a lag between when people get sick and when the confirmatory tests come in. So you're always going to see this number of confirmed cases and suspected cases. And part of the reason why the numbers are going to go up over the next week or probably even 2 weeks is because of this long latency period. You can get infected today and only start to get sick 2 to 3 weeks down the road. And so when you factor in the time that it also takes to get the lab tests back, a lot of the people who are testing positive now were actually probably infected a few weeks back. So the good news is that the majority of people who get monkeypox appear to be recovering. We are currently facing an outbreak because of the West African strain of the virus, which is less severe. So most cases will appear to be mild and are likely going to recover. But some people may get seriously sick. And of course, the big thing that we saw with smallpox was that these rashes would actually leave a lot of scarring on the skin. And so monkeypox is less severe, thankfully, so we see less of that. But there is a real danger that a small percentage of people will get seriously sick and might be left with scarring from where a lot of these rashes are.
So what should people be doing right now to protect themselves?
I think the vast majority of people don't need to do anything different than what they're doing now. If you live in the greater Montreal area, I think very basic precautions are necessary. If you've come into contact with somebody who is a suspected case, you yourself should self-isolate to make sure that you test negative and don't develop symptoms at some point down the road. But the usual transmission for monkeypox really is direct skin-to-skin contact with where the open sores, where the lesions are. Usually have to be in prolonged, sustained contact for several hours. Breathe the same air, be exposed to somebody's bodily fluid for an extended period of time. Most of the people who get sick tend to be either household members of people who tested positive or healthcare workers who are carrying people who are sick because you're coming into contact with these people. So, I mean, this is not the sort of thing you're going to get from somebody at the grocery store. So nothing to worry about in that perspective. But if you have a direct link to one of these people, the best thing to do is self-isolate, inform public health, see if you're a candidate for vaccination, which is starting to roll out, and, test negative. If we can test and identify all the cases and get them to be isolated, we should be able to contain this.
So what challenges might you see in terms of tracking cases, do you think?
Well, I think the big thing is going to be making people aware of this, making people realize that they should think monkeypox when they see this rash and don't say, oh, it's probably chickenpox. Statistically, it probably is chickenpox, but you have to keep monkeypox at the back of your head. So you need to order the proper tests. People need to self-identify, and people need to get over, I think, a bit of a stigma. There is a bit of this stigma in much the same way that we saw with COVID. A lot of people didn't want to say they caught COVID. Some people did, but some people didn't. So a lot of people may not want to say they caught monkeypox. And so if people are reluctant to declare themselves to public health, that's going to make it much harder to contact trace, because you need to know where the cases are in order to be able to test everyone around them for possible exposure.
Dr. Labos, thank you for the information today. Really appreciate the time.
My pleasure. You take care.
You too. That's Dr. Christopher Labos in Montreal.